back to work, the president felt, as he said many times, as I said many times, there was an urgency in moving that forward, and there was less flexibility because he felt the size of that package needed to meet the moment. We are quite open to the mechanisms of how his ideas can move forward. It can be in a number of different proposals. It can be worked through negotiating between members of Democrats and Republicans. There are a lot of ideas, including the Frontiers bill that Senator Schumer has put forward, where we feel there's an opportunity to move forward in a bipartisan manner, and there's some overlap with what's been proposed in the American Jobs Plan. So we do see it as different. We do think the process will be different. There's more time to move forward. There's more time to discuss and negotiate, and we'll take advantage of that time available.
Got it. It's now been pretty widely reported that you're not going to be including a big health coverage expansion in the Families Plan, and that was going to include reducing prescription drug costs. Why did the White House decide not to include that in this plan?
Well, I will say that the president is still making final decisions, as is his prerogative, over the coming days about what will be included in the speech and the American Families Plan, and the final components of that, when those final decisions are made, will be a part of that as well. He will definitely talk in his speech about his commitment to expanding and increasing access to health care, as is evidenced by the fact that we have opened up the enrollment period for the Affordable Care Act, ensuring that more than 500,000 Americans that didn't have health insurance have it now. That's why he included subsidies in the American Rescue Plan to make it even less expensive. But I will also say, even as he's making these final decisions, that the American Families Plan and the speech on Wednesday will not represent the totality of every priority item for him and every item on his agenda that he wants to move forward as president.
And then finally, if you don't mind, India saw the biggest number of new cases in a day ever yesterday. Are there any plans to send any of the U.S. stockpile of AstraZeneca vaccine or any vaccine to India?
Well, let me first say that the United States offers our deepest sympathy to the people of India who are clearly suffering during this global pandemic, and we are working closely with Indian officials at both political and experts level to identify ways to help address the crisis. We've made vaccine cooperation a big priority, including with our Quad partners. India is one of our Quad partners, of course, in discussing vaccine creation and distribution for the future. We've also provided $4 billion to COVAX, and from the earliest stages of the pandemic, we've provided India with emergency relief supplies, medical consumables, pandemic training for Indian state and local health officials, and ventilators, which has been part of our effort over the course of time, including $1.4 billion in health assistance to India to help them prepare for pandemics in the future and deal with the current one we're facing. So there are ongoing discussions. I don't have anything more to preview, but we are in touch with them at a range of levels about how we can help them get through this period of time.
Thanks, Jen.
Sure thing. Go ahead.
Back to the infrastructure negotiations. Yeah. We saw the White House respond pretty positively, or at least consider Joe Manchin's proposal to raise the corporate tax rate to 25% instead of 28%, as was the initial proposal. So should we read this conversation about raising the corporate tax rate to 39.5% as more of a starting offer?
Well, the president's proposal for the American Jobs Plan was about modernizing and making a historic investment in our infrastructure. The tax component was about how to pay for it. We're very open to a range of options, and he has some lines in the sand we've talked about, including not having the American people pay for it, or not being on the backs of the American people. It relates to the capital gains rates and the top margins that you've seen reported out there, the president's bottom line is that people making under $400,000 a year will not have their taxes go up. So if you look at these proposed numbers, which are consistent with what he talked about on the campaign trail when he was running for president, what I can say is that it will only affect people making more than $1 million a year. That's 0.3% of taxpayers, or 3 out of every 1,000 taxpayers. That's even as the top 1% saw their net worth rise by $4 trillion in the middle of a historic pandemic. So he has some bottom lines of where he will not budge fast, right, on individual numbers and who will be impacted, but he's also open to discussion.
We're hearing that White House is also considering in the proposal ending the child tax credit, even though we've seen progressives
extending it,
phasing it out.
Yeah. Well, it's not permanent currently.
Exactly.
So are you extending it or making it permanent?
Is that the position, the definite position? Progressives and plenty of moderates also say that it should be extended permanently. Is that the position?
Sure. What I was trying to clarify, I apologize, is that it's not currently permanent. So the question is whether it will be permanent.
Whether that'll be a red line, like you said, or
Well,
a definite part of the proposal.
And the president absolutely feels that the child tax credit provides essential funding and help to people who need help the most. That's why in the American Rescue Plan, he increased the child tax credit from $2,000 to $3,000 per child and to $3,600 for children under the age of 6. And the expansion was the single largest policy contributor to cutting child poverty, as is evidenced by the chart we had up. We're looking into the mechanisms and the costs of expanding the child tax credit, and that certainly is under consideration for the American Families Plan.
Yeah, it doesn't sound like you guys want to budge on that one.
I think you're confusing though. It's current, and I don't mean it's not currently permanent. So we're talking about how long will be extended. And so what I'm saying is that we are quite open. We think this child tax credit is valuable. It has a huge impact on lowering poverty, reducing the level of poverty in our country. It helps women get back into the workforce. What we're determining is what we can do, and there's a cost of it. It's about $1 billion a year for every year, and so we have to figure out how to pay for it. And this is all part of the discussion.
Can I ask a question about Johnson & Johnson really fast?
Sure.
We've seen so many of the FEMA mobile clinics rely on the J&J shot, obviously because you don't have to keep it so cold and it's one shot. FEMA confirmed that only 9 of its mobile clinics were still operational during this last week with the pause. So is just how hard it is to get the Moderna and Pfizer shots in those mobile clinics part of the slowing rate of vaccinations that we're seeing?
I'm happy to check and see if that's a factor. What I understand the biggest factor is, though, is that we're now at a point where we have reached, just 2 weeks ago, only 43, it's still a significant percent of adults 2 weeks ago were vaccinated, had received their first dose. Now it's 52%. Just 2 weeks ago, only 66 million people had been fully vaccinated. Now it's over 90 million. So we're kind of getting to this point, as I think Jeff Zients touched on this morning, where we are entering a new phase where it is more challenging. We have less of a supply issue. We have more of it's incumbent upon us to reach people and meet them where they are. So that's the bigger challenge in terms of the numbers at this point in time. In terms of the difficulty, I think you're asking about Moderna and Pfizer and how that impacts getting into mobile units.
Yeah,
the temperature.
Mobile clinics weren't really set up to be doing Moderna shots.
I'll have to check with our COVID team on how they see that as an impact. And obviously, we are continuing to adjust the way and the means at which we're getting into communities. And, we make adjustments based on what we think is the most effective. Obviously, the massive increase in pharmacies is a reflection of that. Reduction in some of the vaccination sites. We also make evaluations by where it is most impactful to invest. And some of what we've been doing lately has been increasing our investment in community health centers, in primary care physicians, obviously in pharmacies, but I will check with our team and see if that's a factor. Go ahead.
Thank you, Jen. With the president's first trip abroad in June, that's going to be the first time a president has actually traveled internationally since the start of the pandemic, and I'm wondering if by the time he leaves to go on that trip in June, is he going to lift travel restrictions to Europe as well?
I can't make a prediction of that. That is based on the health and recommendations, the advice and recommendations of our health and medical team, and I don't have anything to predict on that front.
Have there been conversations about that, given he is going to be traveling internationally, about whether it can be a period where everyday Americans also start resuming that kind of a travel?
Well, I would say I think most Americans would see it as slightly different from the President of the United States. I'm not suggesting you're saying otherwise, but as the President of the United States making a diplomatic trip, abiding by COVID protocols and flying on Air Force One, then whether it is safe for mass numbers to fly internationally. Obviously, everybody wants that to be reopened. Europeans, we do, American people who would like to travel, but those conversations are really happening between health and medical experts, and they make an evaluation based on what they think is safe for the American public.
Okay, thank you. And on climate, there have been a lot of questions about the president's new announcement about what he wants to see by 2030.
Yeah.
But I think there are still questions about the specifics of how they're actually going to get there. So there have been studies that have suggested that to get to that kind of a goal, more than half of the new cars and SUVs that are being sold at dealerships would need to be electric. Right now, it's only about 2%. Is that something that the president agrees with, that they need to be at half of those being electric by 2030?
That's not a goal that's not a number or a goal that he set, because he feels that there are a number of ways to get there. And that I saw that reporting as well. That's an example of a way to get there. But there are additional ways, including that impact a lot of sectors, from electricity, transportation, buildings, industry, and lands. Our view is there are a lot of pathways to get to reach this goal. Some of it will be done through legislation, through laws that will be put in place. Some of it will be done to incentivize investment in areas like electric vehicles and electric charging stations, which is already happening in the private sector, right? A lot of the car companies will tell you this is where the future of their industries are going anyway. But we want to incentivize and make that something that we can jumpstart in a lot of those industries. But there are a lot of options for how we get there, and so it isn't just one pathway to get there.
Okay, well, I've got one more question. On this emergent facility
Yep.
in Baltimore,
Yep.
that of course has been plagued with issues, it seems like, and now U.S. regulators have conducted a study and found that they did not follow proper manufacturing procedures. They had poorly trained staff. That resulted in the contamination of materials that, of course, ruined what could have amounted to millions of Johnson & Johnson doses. This is a company that got $630 million from the federal government under the Trump administration, but is that a contract that you are going to keep, or has there been discussion about canceling that contract and not working with this company, given they have not produced one usable dose of the COVID-19 vaccine?
Well, I think some of the AstraZeneca doses did come from there, but that have gone to other countries. But I will say that we believe
The United
for the
States
U.S.
is paying
For the U.S.
$630 million?
For the U.S. I will say to take some pressure off of take some criticism off of the former administration. There are a limited number of manufacturing facilities that have the capacity, as you know, you've been covering this for some time, that have the capacity and have the ability to produce a vaccine like this in this capacity and size and numbers. There's no question, hence they haven't been approved by the FDA for manufacturing, that Emergent has not met those bars and over time has not met those bars. In terms of future contracts, I don't have anything to predict on that front, but we'll continue to look for the FDA to give for it to meet the FDA's bar before we are providing vaccines from there to the American people.
So you're still going down that path for this facility to get approved by the FDA despite the number of issues that they've had?
Well, again, they have to make changes. Obviously, the FDA is working closely with them, and if they make those changes and they meet the FDA's bar, that's a different story. We'll see what happens.
Okay, thank you.
Go ahead, Maria.
Thanks, Jen. Will the First Lady be attending the President's joint address next week, and will she have guests, as has been traditional in those cases?
It will be a little bit different because obviously there will be a limited number of people who are in the Capitol and a limited number that will be determined by the Speaker's office in terms of who will attend and who will have to watch virtually. Well, most of our staff, if not all of our staff, will be watching virtually. In terms of whether Dr. Biden will physically be there in person, I'll have to check on that, Mario. In terms of the box, there will not be the traditional box. We're determining how we can, of course, engage the public and ensure we highlight some of the incredible stories of people who have been helped by the president's policies and proposals, but it will not look like or feel like, in many ways, what past joint addresses have.
For those that will be attending, is the President's preference that those people be vaccinated as well?
This is all. I would send you to the Speaker's office, and they are determining attendance and requirements for those who are attending.
And then a couple of more questions. Any update on Neera Tanden's appointment to the administration at all?
I don't have any update. The President remains interested in and committed to finding her a position in the administration and taking advantage of all of her talents.
Last question. Has the President spoken to the families of either Dante Wright or Ma'Khia Bryant in recent days?
I don't have any calls to read out for you, Mario. I will check and see if he's had conversations with any of those families, too. Go ahead, Jeff.
Jen, a follow-up on India. You said that your discussions about how to help. Can I just ask specifically if the U.S. is helping with their shortage of oxygen right now? Is that something that the U.S.
The shortage of oxygen? Let me check on that for you, Jeff. I mean, we have provided, obviously, a range of funding over the course of time. It's a huge, significant amount of funding. We are likely one of the world's largest contributors to India in terms of their health needs. And it's gone to a range of supplies, and training, but I will check if oxygen is specifically a part of how we can help at this point in time. And they're ongoing discussions, so it may be that that's part of the discussion now.
Okay. Also on vaccines, the European Union said today that it is close to finishing a contract with Pfizer to have what would be the largest contract for vaccine for the coming years. Is the U.S. in talks with Pfizer as well to get more vaccine for post-2021?
I don't have anything about, I'm not going to be able to read out at any point any contract discussions with any vaccine supplier. I can assure you, having worked with Jeff Zients many times over, he is an over-preparer and committed to oversupplying the United States, as is evidenced by the amount we've purchased to date. And obviously, we're cognizant about the needs in the future. But I don't have anything, I probably won't have anything to follow up with you on contract discussions.
Okay, just lastly, yesterday, I think Mario mentioned the stock market dipped a little bit in response to the reports about your tax plans. Just wondered what the White House's feeling is or reaction is to that. Are you concerned about Wall Street's support or lack of support for these policies, and to what extent does that play into your discussions?
I've been doing this long enough not to comment on movements in the stock market, but I did see just data factually that it went back up this morning. Go ahead. Maureen, go ahead.
Sorry. Back on healthcare, there's a disagreement among congressional Democrats about how to use the savings from lowering the government's cost on prescription drugs, whether to put it into expanding Medicare or put it into the expanded subsidies for the Affordable Care Act. Is that something that the White House is going to take a position on, or are you going to let the congressional Democrats work that out in any healthcare legislation?
Well, the president absolutely wants to lower the cost of prescription drugs and knows the burden on Americans and seniors is far too high. He's talked about that on the campaign trail. I expect we will be in discussions about what the plans are and what the options are, but we're not at the point to talk about that publicly quite yet. Go ahead.
Thanks, Jen. On the border, the administration has repeatedly cited the use of Title 42 to demonstrate that the border is not open. This is a Trump policy that progressive groups are increasingly arguing that it denies migrants who are fleeing violence and persecution a right to even apply for asylum. I wanted to know what is the White House's message to these groups who largely are supportive of this White House, who are concerned about the continuation of this Trump policy.
Well, Franco, I would say first that we consider it a policy that was put in place or that we've continued to implement because we're still in the middle of a global pandemic, and that keeping the American people safe and ensuring that we are taking responsible steps as it relates to the pandemic is front and center for the president, and certainly that's what we would convey to any of these groups. At the same time, we absolutely believe that we should be a country that wants to treat people humanely, as is evidenced by our efforts to treat children who come into this country, who are under 18, who are coming as unaccompanied children, in a manner that was not the same as the former administration. So we understand and we have heard the frustration about this issue, but our objective, as the president's objective, is to keep systems in place or keep policies in place or implement policies that help us address the pandemic.
Do you have some goals or some goals of when you may be able to lift Title 42?
I can't make a prediction of that. That will, of course, be based on what the evaluation is by our health and medical experts on the status of the pandemic and the safety of the American people.
Can I ask you just follow up on the Turkey question?
Sure.
I mean, Turkey is a NATO member. Is the administration taking into what consideration is the administration taking into the concerns that Turkey has about potential of this weekend's activities?
I certainly understand all the questions. I just don't have anything I'm not going to get ahead of the president or get ahead of any decisions or announcements. And obviously, any decision that the president makes on foreign policy takes into account concerns expressed by allies and partners around the world.
Can I ask one more about immigration?
Sure.
You know, as we approach 100 days, obviously COVID-19 was the biggest challenge that this administration faced.
Yeah.
But immigration was another one that took a lot of oxygen and political time from this White House. Is there any, does the White House feel like it could have communicated anything differently, done anything differently to address this challenge? Not only Republicans, but even some Democrats have been concerned about some of the messaging.
Well, I would say there's no question. We've recognized that this is a challenging issue, and we knew that it would be when the president changed the policies of the former administration when he came into office. And obviously, welcoming in or ensuring that we had the capacity, we were using resources to treat children humanely and ensure they're safe is a change in the last administration's policy that was going to dissatisfy some who were supporters of the last administration, but not satisfy enough, as you alluded to in your question, some who think we should be welcoming many more across our borders. So it certainly is an issue. As you know, you've covered this quite closely, where we recognize we were never going to satisfy everyone. And what the president's objective has been is to focus on the unaccompanied children, those who had been ripped from their parents' arms, those who were being asked to take a treacherous journey back, ensure we could take steps there. He also wants to push for comprehensive immigration reform, providing a pathway to citizenship, ensuring we're investing and addressing the root causes in these countries. That's something he announced on day one of his presidency. So we are well aware, and there was some reporting this morning that this was an issue that some supporters of the former president and some Republicans in Congress apparently are licking their chops about how to make children a political issue. We don't see it that way. And we felt this was the moral right step to take. And we're going to keep working with immigration advocates, with groups out there to get this bill passed, to get the Dreamers legislation passed. That continues to be a big objective for the president. Go ahead.
Thanks, Jen. Is the president aware of the shooting death of Andrew Brown, a black man from Elizabeth City, North Carolina? And does he believe that body camera footage from the police officers involved in the incident should be released?
He is aware of it. I've not talked to him about his particular view on that, and I believe he'd likely leave that up to law enforcement and others to work out.
Does the White House have a comment on that particular incident as well?
Obviously, the loss of life is a tragedy, and obviously we're thinking of the family members and the community who have lost a loved one. There'll be an investigation into this shooting or into this death, and we will look for the outcome of that.
Okay, on infrastructure, you had noted that the president will travel next week to Georgia immediately after his joint address, I guess is what we're calling it this year, his joint address to Congress.
Always the joint address in the first year of a presidency. A little history note,
After his joint address, do you have any other travel that you can preview for us? Even if it's just to say how frequently you expect the president and the vice president to be traveling to sell this infrastructure package, especially now that all adult Americans are eligible for the vaccine.
Well, again, the president will travel on Thursday as well as Friday. I expect he'll have some additional travel in the weeks ahead of that. You can also anticipate the vice president, the first lady, the second gentleman will be out traveling in the weeks after the joint address. Certainly, they'll be talking about the jobs plan as well as the American Families Plan that the president will lay out in detail at his joint address. But I don't have a prediction in terms of how many days a week. It really depends. We plan week by week and what is needed and we balance, of course, with needs at the White House.
And 2 quick questions about Republicans. You also had said that the president would be meeting with bipartisan groups of lawmakers to talk about his infrastructure package after that. Do you have any Republican senators that the president plans to meet? Maybe a summit that he plans to have?
Aside from the meetings he had last week?
Moving forward, he's about to release his second infrastructure package.
It's not an infrastructure package. It's a families plan focused on child care and helping ease the burden on families, so American Families Plan. I expect he will, of course, probably invite in bipartisan members as a continuing conversation about the counter proposal on the American Jobs Plan, and certainly anticipate he'll have more members of Congress in a bipartisan manner in future weeks. Next week, you kind of have a sense of what the week looks like, right? I mean, he's going to be preparing for the joint address. He'll make some remarks. He's going to travel 2 days, so you can anticipate it would be after that.
The context of the question is that there are Republican senators such as Marco Rubio or Mike Lee who have said in the past that they are supportive of things like the child tax credit and maybe even extending it, but they don't want to see things that they, in their view, see as welfare assistance or permanent entitlements such as, a federal paid leave law or child tax credit extension. So does the White House see some sort of bridge that they can, how does the White House think that they can bridge that divide between the Republicans who are supportive of this generally, but don't want to see permanent entitlements in their view?
Well, I would say first, in someone you didn't mention, Senator Romney has also proposed his own child tax credit plan. And you mentioned a couple of others who have spoken in support of extensions of the child tax credit in different versions. We see that as an opportunity to discuss, an opportunity to seek bipartisan support on a tax credit that we think would be beneficial to families across the country, children, getting women back in the workforce. And so I expect the president will certainly have a range of conversations, and he'll continue to have members into the Oval Office. Go ahead. Oh, go ahead. Sorry, it's a little. I could be more clear. Go ahead, Emily.
Thank you so much. So lawmakers from across New England are pushing for funding for high-speed rail line between New York City and Boston in the infrastructure package. I was wondering if President Biden is supportive of this idea, and how does he envision his infrastructure plan will spur the development of high-speed rail in the U.S.?
Well, it will certainly be a part of it. And when Secretary Buttigieg was here, he talked about this a little bit. And part of the conversation that members of Congress are having, or we're having with members of Congress, is what the composition of grants are. There are some grants that will be specific to individual projects. There are some that will be competitive. There will likely be some that are funding that goes to states. That's how transportation funding has worked in the past, and we expect it to be a combination. So that will be